Euthanasia. In the Encarta Dictionary, euthanasia is defined as the act or practice of killing somebody with an incurable illness or injury, or of assisting a person to die. Euthanasia isn't legal anywhere in the United States. However, the Death with Dignity Act is. According to euthanasia.net, the Death with Dignity Act is the act of a physician prescribing a lethal dose of a medication to a patient, but the patient themselves has to take that, not the doctor. The only states in which the Death with Dignity Act is legal are Oregon, Washington, and Montana. In order to participate with the Death with Dignity Act, you have to meet a certain criteria. The criteria consists of being at least 18 years of age or older, having a terminal illness that will lead to death in 6 months or less, being of sound mind and being able of making your own decisions when it comes to your health, and being a resident of one of the aforementioned states. After meeting the particular criteria, a physician must look at you and determine that you've met it and that you do have at least 6 months or less to live. Upon their approval, an additional physician must come in and make the same assumptions. Once this is determined, the patient must submit at least 2 requests verbally to the physicians and tell them they wish to end their life with the Death with Dignity Act. Upon doing this, they have to give written approval of doing this, and there has to be a witness upon writing it. After all of this is done, the physician will prescribe the patient with a lethal dose of medication. The most common dose of medication that's given is a barbiturate. When considering the possibility of legalizing the Death with Dignity Act or euthanasia in the United States, something I want you to take a long look at is a DNR order. A DNR order is a do not resuscitate order and is most commonly used in nursing homes and in hospitals. What a DNR order is when you decide that you don't want to be resuscitated. It's you signing a waiver saying that if you become incapacitated, you don't want CPR or any life support placed on you. A DNR order is a decision against life-saving measures and may only prolong a patient's pain and death, according to surgeryencyclopedia.com. Euthanasia isn't a political issue. It's not even a religious issue. It's a human rights issue and a medical issue for yourself. We choose to wake up every single day. We choose to go to work every single day. We choose everything we do in our life. We make our own medical decisions. We don't allow anybody to do that for us. So shouldn't it be our right to choose our end-of-life care and how we decide to end things if we have an incurable illness and decide that we have nothing else, there's no hope, there's nothing else to help us. We come closer to death every day when we wake up. So why should a person who has to live and suffer through a terminal illness, cancer, anything, have to suffer and wake up every single day knowing they're going to have to endure that same pain? It's our right to make the determination for our end-of-life care.